Before you move on to expensive IUI or IVF treatments, these are 5 labs that every fertility clinic should be running before even mentioning either of the two. And I know this because my fertility clinic didn't even mention it. They actually said that some of these tests are even useless. Turns out, one of these tests, thankfully I did it, was the answer that I needed. Let's get into it. The first one is going to be a comprehensive thyroid panel. My fertility clinic only ran my TSH and my T3. Well, you also have a T4, a reverse T3, and also thyroid antibodies that they should also be checking for, because even subclinical thyroid problems can lead to miscarriage and conception issues. Why they're not running it, I don't freaking know. But to me, that's bare minimum. Number 2, a full iron panel. A lot of women think that they are getting tested and having a full iron panel, but all your doctor is actually checking is your hemoglobin, when they should also be checking your ferritin, your serum iron, and your TIBC. Ferritin is crucial for egg quality, ovulation, and your pregnancy. Now, number 3 is the one that I didn't even know existed until my functional practitioner mentioned it. And thankfully she did, because this was actually the answer that I needed. And this is your leptin. Apparently, your leptin is crucial for reproductive signaling. It's actually your satiating hormone. So it's the hormone that tells you that you're full. And apparently, if these are too low or too high, it can affect your ovulation, it can affect implantation, and overall your pregnancy maintenance. It should be between like a 7 and a 15. So if you've been diagnosed with something like unexplained infertility, which between you and me, this is a very lazy diagnosis, especially with how little testing they do. It's like, how are you even coming to that conclusion? Anyway, but this could be huge for conception and why you're probably not getting pregnant. Number 4 is methylation and your homocysteine. This is going to be your folate and your B12 status. Methylation is critical for your embryo health and DNA synthesis. So if you actually have high homocysteine and poor methylation, this can increase your chances of miscarriage and also impair egg and quality health. So this is a test that you and your partner can both do. And what people don't realize is a lot of IUI and IVF could fail because of just egg and sperm quality. So it's shocking to me that they don't check these 2 things, because this is a really good indicator of what your egg and sperm quality is. Thankfully, mine were both great, so that wasn't something that I had to worry about, but I can only imagine so many people that don't even know to check for it and kind of rule it out. And the last test is a comprehensive inflammatory and autoimmune panel. Again, even if you choose the route of IVF or IUI, these are going to really help your chances of increasing their success. Because as we know, they're not always 100%, and there's a lot of reasons why. So these tests include something like a C-reactive protein, which checks your inflammation, your ANA and your APA, which can actually be linked to reoccurring miscarriage. So if you're someone who's dealing with that and your doctor is not checking for those 2 markers, ask them immediately, because underlying inflammation can also be a big reason why IUI isn't working or you have failed IVF cycles. And these are just 3 easy bonus labs that I did as just pretty much basic markers when I worked with a functional practitioner. The first one is an organic acids test, or the OAT test, and this checks for nutrient deficiencies, which can definitely impair conception. The second one is a Dutch test, which I try to do yearly because it really helps with estrogen metabolism, your adrenal function, and your optimal progesterone levels. Doing blood work in the office is great, but it doesn't really give you the full picture. This is also a great test if you're just struggling with hormonal issues or you're not sure if you're ovulating optimally, etc., etc. It's probably my favorite test. And then the last test, which is like a 2-in-1, I would do a stool test to really check your gut microbiome, and also a vaginal microbiome test. I personally did one to check for ureaplasma, because apparently that could be linked to reasons you're not conceiving or even reoccurring miscarriage. Thankfully, I did not have that, but it's still good to check for any type of dysbiosis in the gut or in the vaginal microbiome. To me, these are basic markers that all clinics should be doing before even mentioning the words IUI or IVF to you, because it really gives a much larger picture of what your health is and what is actually happening.